Doan Quang Minh. I am currently the MBA student at Greenwich, Vietnam. So this is my individual vlog for subject marketing and sales in future economy. I'm applying for company GSK and with the marketing train, personalization and customization of customer experience. So a quick introduction of GSK. They are a global biopharmaceutical company headquartered in London, UK. GSK operating a wide range of pharmaceutical scope. Their product portfolio contains multiple brands classified into three main groups: general medicine, specialty medicines, and vaccine. And regarding to vaccine, GSK is one of the world's leading vaccine producers. They have a diverse portfolio of vaccine. But today we are going to focus on product Synflorix, which is known as PCV10. It helps to reduce the invasive pneumococcal disease, pneumonia, and middle ear infection in children. It should be noted that the marketing in pharmaceutical industry are covered by very strict compliance from both global and local laws and regulation. Thus, just like the other pharmaceutical company, GSK had four main popular marketing type. The first one is grant, donation, and charitable contribution. The second one is publish, disease awareness. The third one is scientific to sponsorship to the healthcare organization. And today we are going to focus on the fourth type of marketing activity, the engaging with healthcare professional. Healthcare professional or HCP play a crucial role to vaccination to patient. That's why every pharmaceutical company put their effort and resources to engage with HCP, and so understanding HCP clearly to design an appropriate marketing strategy, especially with marketing communication, is very critical to GSK that they should keep exploring, updating, and improving. So one of the emerging trends that I'm gonna apply for GSK today is the personalization and customization of XCP experience. It should be conducted in terms of a research project. We will have to start with a survey and data collection before conducting personalized and customized XCP following their response on four key drivers: attitude, behavioral, rational, and emotional drivers. So after completing this project, GSK can expect to receive some key advantages. For example, they can identify a meaningful and differentiating XCP segment. They can develop an in-depth understanding of segment characteristic that can be leveraged to help drive PCB XCP recommendation in action. And most important, GSK can improve their marketing engagement with XCP by customizing the content and approach that can target correctly to the XCP need and enable the consulting effectively to their patient. So here are the examples that I have prepared on the data and assumption that collected from different reports of WHO, UNICEF, National Immunization Program, some published medical survey, and of course some other confidential resources. So from this, from each analysis of the result data, I classify XCP into 5 XCP persona, and from that I suggest for each kind of persona with a proper marketing communication plan for GSK. 5 XCP persona: emerging advocates, protocol followers, overburdened, reactive, uneducated, and uninterested avoiders. The first emerging advocate, the first persona is emerging advocate. These XCP, they committed to protect patients from the impact of PCV-related disease. Their experience and knowledge empower them to proactively discuss and recommend PCV vaccination to the XCP. That's why I would suggest GSK should engage the XCP as speakers in their scientific congress or as KOL and influencers in their key marketing campaign. The second XCP persona from the research result. These XCP only strongly recommend PCP after they considering the key factor and one they are convinced of the PCP benefit. So for these kind of XCP, the marketing communication plan for GSK should focus to deliver the content with proven clinical data and research result. So if GSK can include the national guideline in the material delivered to this kind of XCP, it will be very good. And the third group is overburden reactive XCP. These XCP, they consider PCV vaccination as just an optional. So if they don't have so much time, they will not prioritize talking about PCV during their discussion with patient. For this kind of XCP personnel, GSK should leverage the train the trainers model and KOL to increase their intention to consult the patient. The fourth group is uneducated. These XCP, their familiarity with the PCV disease and vaccine are just limited, and they don't know what to think about the vaccine and who it is best suited for. And thus, GSK should increase the published education content delivered to these kind of XCP, and probably GSK should think of finding a way to increase the word of mouth that they around the social discussion around this kind of XCP. And the last group is an interest avoider. The XCP from the research result, they think that the benefit of PCV vaccine do not always outweigh the risk. So they usually cautious and worry about having PCP discussion, mentioning it, and tend to have a tendency to avoid talking about PCP. So if GSK just had a limited budget for marketing, definitely these kind of XCP personnel should not be prioritized. But in long term, GSK should continue educating them on disease awareness, burden, and prevention. And for after setting the communication plan, communication strategy for each group of XCP personnel, I would propose for GSK the KPI for each kind of activity presented on the screen, and to make sure that these are effectively operated and managed. GSK should think of the measure to measure the KPI on a continuous and frequent basis to ensure that effectiveness and timely update, they can timely update if it is required. And most important, GSK should ensure the strict compliance, which is the most important principle in the pharmaceutical industry. In marketing, for example, no direct-to-consumer promotion. They should ensure the fair balance and the effective adverse event reporting, as well as the data privacy protection. That's all for my individual vlog for this subject. Thanks for listening.